So when we talk about cancer survivorship, we mean the process of living with, through and beyond cancer. So 1 in 2 Australians by the age of 85 will be diagnosed with cancer, which means that almost every Australian family will be touched by cancer. Despite the fact that we've had incredible success in improving survival, a significant proportion of patients and cancer survivors are living with a range of physical and psychological adverse effects as a result of their diagnosis and treatment. It also means that risk of a range of other health conditions, including diabetes and osteoporosis and cardiovascular disease. And furthermore, the treatments that cancer survivors are actually accessing sometimes are based on very weak or little evidence. Furthermore, their care is also quite fragmented. So the ACRF grant has enabled the creation of the ACRF Oasis facility. And Oasis stands for the Oncology Alliance for the Science of Integrated Survivorship. And we believe that this will be an absolute game changer for cancer survivorship research. So what we've done is created a facility that will be essentially a magnet for survivorship researchers and pull together and harness the power of key research groups working in this area. And what we'd like to do with the Alliance is build the science and therefore the evidence base for optimal survivorship care. Some of the key research pillars in the ACRF Oasis facility will include physical activity, cardiovascular health and outcomes, integration with primary care, psycho-oncology and complementary medicine. So we're completely excited about this amazing opportunity. Well, there are several key features of the ACRF Oasis Alliance. Firstly, we believe it will be a game changer because essentially it will impact every cancer survivor, irrespective of their cancer type, across the age spectrum, and we really would like to take a whole of journey, systematic and broad approach to our research. Secondly, it will be underpinned by a novel e-health platform, and that platform will enable us to collect data prospectively and longitudinally over time. It will enable us to collect biological and tissue samples, patient-reported outcomes, and so not only will we have a sense over time about short, medium and long-term outcomes, but we can actually design and implement the effective interventions not only for specific groups of survivors, but really to have an impact across the disease and treatment journey, both from diagnosis to end of life. And we're particularly excited that we can take such a broad and systematic approach. The final thing that excites us particularly is that the ACRF Oasis facility will really be an amazing nexus or connection between the research community and the actual health professionals delivering care at the coalface. So this means that we can actually undertake the research and design the interventions, and they can directly be implemented into clinical care. And we believe that this will have not only a national impact, but that the research outcomes will really be relevant internationally. On behalf of the Oasis Alliance, we are incredibly grateful to ACRF supporters for their amazing generosity, but also importantly for recognising at this time that cancer survivorship research is so important in terms of the research community and the research space. And we're incredibly excited at the opportunity to not only develop the science and build the evidence base, but really at the amazing impact it will have on cancer survivors, their families and the broader community.